Pap smears? Ugh, just the sound of it makes me cringe. But why do women need them, and why are they important for our health? I'm Dr. Jelliffe, a board-certified pathologist, and I'm here to tell you in 4 minutes or less. I know, the dreaded stirrups. But it's so important to get these early detection and prevention tests to make sure that we stay healthy. First things first, you're gonna need your pathology report. If you don't have a copy, simply ask your doctor for one, or some hospitals even have an online portal where you can go and print it out. Once you have your report, find the section that says final diagnosis or result. That's where the important information is that we're gonna look for. Did you know that as a patient, it's your right to have a copy of every result that's in your medical record? So make sure you empower yourself with that knowledge and know everything you can about your health. But before we get to the results of your pap smear, let's take a look at what the doctor is seeing when she's looking up in there. Here's where your cervix is. It's at the very bottom portion of your uterus. When she looks in your vaginal canal, she sees a round inner tube-like structure that's called the cervix, and it has a small hole in the center. Then she takes a small brush and brushes the surface of the cervix, where she scrapes off some cells. The cells are then sent to the lab, where we get to look at them under the microscope. Here's what normal cells from the cervix look like. They're kind of like pink squares with a purple dot in the middle. That purple dot in the middle is called the nucleus, and it's what I like to call the brain of the cell because that's where all the DNA is. When a virus called HPV infects the cervix, the nucleus in those cells gets enlarged and darkened and wrinkled, and it kind of looks like a raisin. It can also kind of get a halo around it, like an angel halo. These findings are called a low-grade squamous intraepithelial lesion, or LSIL. Check on your pathology report now to see if that's what you have listed. If you do have this, you're probably surprised because you're probably not having any symptoms from it. The good news is many of these infections go away on their own, and the chance of them turning into cervical cancer is really low. But you should still follow up with your doctor to find out what the next best decision for you is. Back to our normal cervical cells. Sometimes when the HPV infection happens, it causes a more severe reaction, and that nucleus, the brain of the cell, gets even larger and darker and takes up more of the cell. You can see that that angel halo is gone, so you know it's not acting like an angel anymore. These lesions are called high-grade squamous intraepithelial lesion, or HSIL. Check your pathology report to see if you have that listed. If you do have this listed, it's so important that you go back and check with your doctor because these do have a chance of turning into cervical cancer. It's very likely you will have to have this lesion removed from your cervix, and that's the best way to prevent it from turning into cervical cancer. So check your pathology report to see if there is LSIL or HSIL on there. If there's not, and you have another question about your path report, or if you've been diagnosed with cancer or someone you love has been diagnosed with cancer, visit us at honestpathology.com and speak with a board-certified pathologist about your specific case. We'll help empower you with knowledge so that along with your medical care team, you can make the best decisions for your care. I'm Dr. Jelliffe, and this has been 4 Minute Path Report. See you next time.